And while South Africa fights a cholera outbreak in Hammanskraal, there have also been other cases within the SADC region. And for more on this issue now, we are now joined by UNICEF Regional Health Advisor for Eastern and Southern Africa, Dr. Paul Ngwakum, and he joins us via our Zoom link. Dr. Paul, thank you so much for joining us here on the late edition. Of course, looking into the problems facing South Africa, we have now seen that these cases are now increasing. We've seen one case that was earlier reported in the Free State. We also then saw another case now in the Northwest. When you look at the increasing numbers of this cholera outbreak, was this to be expected?
Well, I think cholera is a very simple disease to understand. It's due to ingestion of food or drinking of water that is contaminated by the bacteria. And I think authorities have to ensure that there is good surveillance, and there has to be case tracing to make sure that the cases are traced and the contacts identified and the prevention measures taken rapidly.
And okay, looking at what has plagued South Africa, earlier this year in February, there was a case in the Limpopo region. And of course, we were told that when they had traced this issue of cholera, it was then traced back to Malawi, and this was in February. And of course, now we are dealing with something else as the city of Tshwane battles to find, where indeed this cholera outbreak initially came from. Earlier on, we were also then told that maybe this outbreak has the potential to come from within the SADC region, from other countries in the SADC region. When you look at this, is there a possibility that what is taking place in Tshwane can be linked to other countries within the SADC region?
That's very possible. As you may know, there are 6 countries in Southern Africa that are having cases of cholera since March 2022. And we are having porous borders with populations moving from one country to the other, or even within the countries. You have a country like Malawi with a lion's share of the number of cases of cholera. Over 58,000 cases have been recorded. You also have Mozambique with high number of cases. You have Zimbabwe, you have Zambia. Eswatini had some imported cases, and now we are having this surge in number of cases in South Africa. And I think it's very possible that it can come from one province to the other, or from one country to the other and spread if the surveillance is not very, very strong.
And Dr. Paul, what are you finding as the contributing factors or the commonalities you are drawing from these cases within the SADC region? You've gone to great lengths to explain how many other African countries within the SADC region are affected by this cholera outbreak. What are the commonalities you are finding with the reported cases?
Well, I think the commonalities is that in the SADC region, in Eastern and Southern Africa, we have many drivers. The first driver is linked to issues of lack of basic social services. You need to have potable water, you need to have good hygiene and sanitation situations for the communities. The second situation, which I think exacerbates this spread of cholera, is the weather patterns, the changing weather patterns. We had recently in Southern Africa floods and cyclones that kind of unearthed disease and contaminated drinking water for some of the countries. Other issues, maybe not specific to South Africa, is issues that are linked to conflicts, armed conflicts that cause movement of populations and difficulties accessing some of these areas, increasing the spread of cholera. But the basic fundamental issue, as I said, is absence of basic social services. And in the region, we know where the hotspots are. I think all governments know where the hotspots for cholera are. We have to ensure that in these hotspots, we have preparedness and response. And in this hotspot, the people who have are the poor people. They are the people who are having inequities. They are people who don't have the basic social services, water, sanitation, hygiene, and access to primary health care.
And what needs to be done by these countries in Southern Africa to ensure that, the cholera outbreak is indeed contained and we don't see a further spread, be it a further spread into other provinces or be it a spread into other countries?
Well, as I said, cholera is a very simple disease to understand. It is due to ingestion of food or water that is contaminated. And in all these countries, what is happening is when they have an outbreak, they come out with what we call activation of the Emergency Operations Center. That exists in all the countries I've cited, in Southern Africa or in Eastern Africa. And they have to organize themselves in different pillars. The first pillar is the coordination that has an oversight on the preparedness and response plan. You have to have a strong surveillance that's going to identify the cases, map these cases, do the case tracing, contact tracing, and ensure that there's targeted response. But above all, there has to be provision of potable water because water is one of the main sources for transmission of cholera, hygiene and sanitation for the affected or the at-risk populations. Another issue is linked to social behavior change. People have to be educated. They have to consider what we call risk communication and community engagement. But above all, for the unfortunate cases that get infected, there has to be case management. And for case management to occur, they need to have the treatment centers. In these treatment centers, they need staff that are competent and that are motivated to be able to provide the services. There are other issues that they have to consider in a very acute situation where there are so many cases, which is continuity of essential services. In addition to responding to the cholera, children need to continue to go to school. We have to continue nutrition or else we finish with cholera and we have to come and have gaps in other basic social services.
And lastly, how long can it take for a country to recover from such an outbreak?
That is a very important question, actually. I think you cannot give a blanket a prescription of how long a country can take to recover because it depends on the resilience which this country has before the cholera hit. And I think I just want to profit to say resilience building is a choice of a government. And I think governments have to make the right choices for their population. And this is by investing in basic social services, ensuring that there is potable water, there is hygiene, there is sanitation, ensuring that you have primary health care, ensuring that these services is distributed with the equity lens, taking into consideration the population that are living in the at-risk areas, who, as I said before, are the poor people, are the people that are suffering from inequities, are the people that are exempted from basic social services, and for the case of cholera, potable water, hygiene, and sanitation conditions.
All right, then. Thank you very much, Dr. Paul Ngwakum, for your time. Really appreciated. That is indeed Dr. Paul Ngwakum. He is from UNICEF and he is the Regional Health Advisor for East and Southern Africa, giving us just a bit of his insight in terms of how a country or in the SADC region we need to deal with the cholera outbreak.